Hey everyone, welcome back to my channel. So today's video is going to be a nursing school related video, and I wanted to talk about things that I feel you should take to clinical, just because these things have helped me get through my 3 semesters of nursing school. So if you're new to my channel, my name is Brittany. I'm a 4th semester RN student, and my clinical days are numbered at this point. So I want to make sure that when I go to clinical, I have everything I need and I don't take too much. Because when I was, you're saying hi? When I was a 1st semester RN student, I felt like I was taking just everything, just because I was so, just in case I need. So half of the stuff I found I didn't really use. I just took it and lugged it around for nothing. So this is a bag I got off of Amazon, and I think I got it for well under $10. I got this, but I didn't start using it until later, in my nursing school career. All right, so let's just get right on into it. But before, be sure to subscribe if you haven't already, and if you want to see more videos from me. I am a mom and a wife and a nursing student, so I kind of just make a bunch of different videos, lifestyle videos. So I'm gonna get into the tools first. So these are must-haves as a student. You must have your stethoscope. This is just so super important, and it's kind of common sense, but some people might be under the impression that the clinical site has stethoscopes for you, and they don't. They will only have like disposable stethoscopes that you can only use on one patient if they're on contact precaution. So you need that. You definitely need some black pens. Don't ever use blue pens, always use black pens. And obviously you want to take your bag. I'll just show you guys like my little picture here, but make sure you have, I have like 2 badges. At one point I had 3 badges. It just depends on what the facility wants and how many facilities you're going to. You also, I also had a secondhand watch. This is from Casio. I really like this one just because I never took my Apple Watch, because I wanted to make sure that I was learning to master like the manual blood pressure cuffs, taking my respirations and my apical pulse for 1 minute. And I just felt like it also has the military time on there too. So that's why I really like this one. But even if you do take your Apple Watch, just make sure you always have a secondhand watch, just in case. You never really know. And then you for sure want to have a Penlight. This Penlight I got off of Amazon, and it also has like the millimeters for the pupil dilation. You don't have to have this, but you do have to have a Penlight. And this is absolutely necessary for head to toe assessments, especially your neuro checks if you're in the ICU. This is just important. So like your stethoscope, your watch, your Penlight, and those are just basics for your head to toe that you need to have. I also carry these scissors. I think all nursing students do, because you sometimes have to cut tape, or you might have to cut something open, or in emergency situations, people just cut the clothes off, like possibly in the trauma or emergency room. So just make sure you have these, especially as a nursing student. Sometimes the RN that you're working with that day asks for scissors or a Sharpie, and you want to make sure that you are prepared. Also a Sharpie, because you need to label everything. If you get a urine sample, if you do a blood draw, if you, let's see, just anything, even wound dressing changes, you want to make sure that you initial, date, and time it, and you always want to use a Sharpie. Always, and just have a Sharpie with you all the time. That also reminds me, I don't have it with me, but you might want to have a expo marker so you can write on the board. You can write your name and introduce yourself to your patient. I also have a little notebook, and this, I do recommend a little notebook that maybe fits in your pocket, and you can just write little notes. I would write, like when I did my ICU rotation, I wrote all of the ICU head to toe assessment. And it's quite a few pages, but I was able to reference it a few times. And then after that, I just kind of remember something I don't know, I write it in here, and then when I go home, I look it up, and it really helps just to reinforce what you learned that day. So this is good, and it's super tiny. It fits in my scrub pocket very easily. Another thing that I found was super helpful during my clinicals was this Surg clinical companion. If you guys haven't already seen how I study for Surg, I'll link it down below. But this is the little companion that comes with my large Surg book, and this was super helpful because it kind of just goes through all of the different conditions. It has, let's see, like heart failure was a big one. So it has heart failure. It has an overview of what it is, different types of heart failure. It also has so assessment, which is really important. It also has priority actions. It has interventions, and it also has some nursing diagnosis. It has labs, and it has meds for that particular disease. So I highly recommend it. It also has, let's see, surgical management, community-based care for a lot of the diseases. So if you have a Surg book that has like a little companion with it, I highly recommend it. I took it with me to clinical all the time. All right, and then this is something that is optional. It is a clipboard that folds in half. First semester I lugged around this huge clipboard, not necessary. I'm probably thinking of retiring this as long as you have like a piece of paper that you can write your S-bar and any notes. I highly recommend that. My camera is dying, so. Also carry around a little deodorant. You never know when you're gonna do a skill that makes you super nervous and makes you sweat, and it makes you, or if you're in a code and you're doing chest compressions, you get very tired, maybe a little sweaty. Always have that backup. And last but not least, make sure you always have a water bottle. Make sure you always stay hydrated during clinical. This is so important because if you can't take care of yourself, you definitely can't take care of patients to the best of your ability. All right guys, so my camera is about to die, so I need to end this video. Please thumbs up if this has helped you in any way, and be sure to subscribe if you guys want to see more. Thank you so much for watching. I'll see you guys in my next one. Bye.